Hello, ladies and gentlemen. It's a pleasure to welcome you on this WSIS talk. In today's talk, we'll see how the low tech plays a key role in creating digital lifeline in the time of crisis. Today, I'm delighted to have on this round table three exceptional guests. Sonia, who is the Executive Director of the Alliance for Affordable Internet. Jessica, who is the CEO and founder of Celled. Asim, who is the CEO and founder of WebDoc. And I am Sebastien Codeville, the CEO and founder of KaiOS Technologies. I will start with a short introduction, and then we'll divide the time between the four speakers and finish with a Q&A session. Please use the Q&A session at the bottom of Zoom window to send us your question anytime during the presentation. Captioning in English will be available in Zoom option. But before we start, I would like to stress two concepts in today's topic that I feel are very important: low-tech and digital lifeline. When people ask me in which industry KaiOS is operating, I often answer we are in digital low-tech. If you search in the dictionary, low-tech, it's often defined by what it is not. It's not using modern and sophisticated technology. It's less advanced. It's not using the most recent methods. And the synonym of low-tech are even worse. It's regressive, backward-looking, uncool, obsolete, fossilized. And you might wonder why I call KaiOS a low-tech solution. There is actually another interesting definition in Wikipedia, and I will read it out for you. Next slide, Tim, please. Low-tech are no longer restricted to old techniques, but also extended to the new future-oriented techniques, more ecological and intended to recreate social bonds. A low-tech innovation is then possible. It will then oppose planned obsolescence of objects and question the consumer society. Low-tech must therefore be accessible to all and could therefore help in reduction of inequalities. I believe this applies well to what the four of us will talk about today. The second concept I want to highlight is the lifeline, the digital lifeline. We all know how important accessing to internet is, especially in this time of crisis, to contact emergency, to access live death critical information, but also, as we have all experienced recently, to simply continue to work, study, and stay in touch with friends and family. But internet can't be taken for granted. Next slide, Tim, please. A few weeks ago, UNESCO reported that 700 million kids kept out of school because of COVID-19 are lacking basic internet access. This information has been widely covered by the media around the world. So hopefully, the focus and the effort to give everyone an internet lifeline will further accelerate when COVID crisis will be behind us. So in the next section, we will discuss how policies, product innovation, and meaningful content are actually having a true impact on digital divide, especially in a troubled period as the one we are in today. And it's now my pleasure to introduce Sonia, who will share her thoughts on policies.
Thank you, Sebastien. Thank you all. And thank you for the ITU and the crew at WSIS for organizing these really wonderful dialogues. It's a pleasure to be here. So I'm Sonia George. I'm the Executive Director of the Alliance for Affordable Internet that I hope most of you know. And if you don't, please take a look. We are a program, an initiative within the wider Web Foundation. Kim, can I have the next slide, please? A4AI, and the next one as well. A4AI works exactly in the space of access and affordability to the internet, as most of you know. And one of the things that was very clear when the current crisis came upon all of us around the world was that we had a massive undertaking to tackle. The bad news, which were very big, as you all know, was that this crisis was indeed unprecedented and global, at the global level, affecting people everywhere in the world, not just developing countries, but developed countries. The good news was that, I'm sorry, and part of the bad news was also that because it was affecting people everywhere, it also became more clear to more people than normal the vast inequalities that exist in the world. So not only it was a crisis that was really quite overwhelming for people in all different sectors of the economy and society, but indeed uncovered inequalities that many people don't usually tend to focus on. The good news was that all of these has also mobilized incredible resources, action, and decision makers to do things that frankly normally takes them a long, long time to do. And so to be honest, one of the things that has been really interesting about these very difficult, challenging times is that we've come to the understanding that not only the crisis exposed these inequalities, but really propelled a lot of action that we were not expected to see. We at A4AI, and in fact at the Wider Web Foundation, have also gathered our resources and our thinking time and highlighted the kinds of policy actions that many governments, companies, citizens, and together as well, how they could work. And the reason why we did this was for two reasons. One, as you can understand, many of you, I imagine, on this call are folks that are thinking about the digital divide on a daily basis, as we are. And it was very important for us to understand, first of all, what were the real right policies that could be supported to make change in this very critical time. But most importantly, what were the things already that especially governments were doing that were actually showing results really quickly? And so we identified across all of the different stakeholders the different kinds of things that they could do, and some of which actually showed results very quickly. On the part of the governments, many of them immediately took on initiatives to either remove or stop proposals to increase taxation either on devices, on data services. Others very quickly made additional spectrum available for different kinds of providers, including alternative providers. Companies also became much more relaxed in their way of addressing the users' needs. Many also joined governments in partnership and formed new initiatives, new efforts to not only expand reliable connectivity very quickly to underserved and unserved areas, but also to quickly deploy investments that really were just waiting for the ongoing lengthy authorizations, permissions that often we see in many countries. And of course, this is not just in developing countries, in fact, also in developed countries that also take their time to make decisions and frankly, far too long. What I've been telling many of our colleagues and partners is that sadly, we needed a crisis to show that we actually connect a lot faster. And so it's sad to say, but it appears that we need to really think about the digital divide, and especially, I would say, the digital gender gap within the wider digital divide as a crisis that in fact has been with us for a long time, and in fact is increasing in magnitude and increasing in scope. And therefore, we all in our sector, in the ICT and digital sector overall, should in fact act faster, mobilize our resources, mobilize our thinking, and be more innovative, including at the policy level. So what I wanted to say, just to highlight, and Sebastien, please tell me if I'm going over my time, so I stop where I should. I didn't put my timer right at the beginning, but I'll tell you just a few things that I think are worthy to highlight in terms of actions that policymakers took very quickly in the midst of this crisis. In countries from Italy, governments and private sector came together to quickly build infrastructure that wasn't there, but was actually in the plan for many, many years, to areas that were remote or that were more marginalized in the country. In Panama, government made spectrum available very quickly. In South Africa, the same way. In Zambia, many governments made spectrum very quickly available, spectrum that has been just waiting dormant and not benefiting anyone, especially in rural areas and underserved areas. And interestingly, as well, in some countries, as well, like in Liberia, governments and actually companies went as far as donating hundreds of devices to facilitate, because as many of you know, it's not just about having connectivity, but having the ability of affording and accessing the devices that will allow folks, from companies to individuals to students to policymakers, to actually use the internet. But I will stop there. I'm sure we'll have lots of different questions and comments later. And thank you again. So back to you, Sebastien.
Thanks, Sonia, for all these thoughts. So the next thing we'll talk about is product innovation. Today, 4 billion people are not connected to internet. And out of these 4 billion, 3.3 billion are covered by internet, by an internet-capable network. Tim, yes, thanks. So why are these people not connected when they could have an access to internet? Next slide, Tim. So we see 4 main reasons. The first one is internet is not affordable. As you just said, both the device actually and the data are too expensive. And at KaiOS, we did some research on our key markets, and we found we use basically the GSMA mobile affordability threshold, which is defined as 28% of monthly income. And we look at how many people could buy a basic phone but could not afford the cheapest internet smartphone. And the result is that tens of millions of people are excluded. 50 million people in Pakistan, 37 million in Bangladesh, 17 in Indonesia, 86 million people in Nigeria. The second issue is internet is not accessible, and the main blockers are illiteracy, the fears, and the complexity of use. There is 40% of adult illiteracy in low-income countries, and we are talking here about almost 1 billion people. We need to rethink the way we make internet accessible, internet devices accessible to them. We also talk and study the fears, different fears, and we see that as an accessibility problem. We found when we surveyed our users in Nigeria that some of the people simply disconnect data because of fears of spending too much, fears of being stolen, fears of being abused. So the third reason why people do not connect is internet might not be relevant for them. How relevant is a phone if there's no local content available in a language I understand? More than 95% of the time spent on internet in Africa is actually spent on non-local content. And the fourth reason is internet might not have proven its usefulness. If I have, let's say, $20 available at the end of the month, why should I spend it on buying a phone rather than something more essential, especially if I don't see how a phone can help me to raise my wealth in the future? So next slide. At KaiOS, we took an inverted approach, the opposite of what an high-tech industry is doing. We decided actually to work on durable and affordable devices as a starting point, the basic phones. So no touch panel, smaller display, and long battery life. And we created an operating system specially designed for this basic device, but with internet capability and modern digital services added on top. And all of that is using web technology, standard API, and open source. So KaiOS devices are a bridge between basic phone and smartphones. And they offer the best of the two worlds: popular apps, long battery life, modern connectivity, accessibility. We are, by the way, focusing on making the user experience simpler and more accessible for people with limited literacy, durability, and affordability. Affordability, I want to highlight here, we are working on a device financing program to bring the price of entry internet device at the price of a 2G basic phone. And thanks to our app store and the capacity to deploy apps to phones already in the market, we were able to, when the COVID crisis started, we were able to deliver with our partners some useful application with some verified content from WHO, translated in a number of local language, as well as regional status of the virus spread. So I would like to conclude KaiOS section by saying that in the past 3 years, KaiOS has connected more than 130 million people to internet. And this is a big achievement, but we need to go much further and beyond that. So now that we have reviewed policy and product innovation, we are going to talk about education. And Jessica, you are the next speaker. So please, the floor is yours.
Great. Thank you, Sebastien. Thank you, Sonia. And gratitude for being on such an extraordinary panel in an extraordinary time. I'm Dr. Jessica Rothenberg Aalami, the CEO and founder of CellEd, where we bring universally accessible content to the hands of anyone with a feature phone or any other device. And why we do this is to bridge three critical things: the opportunity divide, the digital divide, and ultimately access to education in real time. Next slide, please. And we started where most people didn't, in the Silicon Valley, where we're based. We started actually on feature phones, providing non-literate adults reading material, learning to read over texting and audio. And with that innovation, we were able to build from there a suite of programs and access to coaches that provides literally a lifeline to those who had no access to training in person or otherwise. There are 100 million people in the United States lacking access to training and to jobs, and 2 billion worldwide. And CellEd, I'm not alone. I'm representing a team of teachers and technologists who are deeply committed to bridging this combined challenge that was made even more obvious under this pandemic. We've increased our programs. We have 3. One is called CellEd Essentials, where we deliver essential skills programming in 3-minute micro lessons with audio and two-way text on any device. We also add that with work-ready programming and, again, literacy programming to actually bridge the literacy, math, and other skills gaps. We also offer a program, CellMed, where we are able to train community health workers and others on COVID-19 programming and more. And we have a third. We are an arm, a mobile arm of international development agencies that are reaching the hardest to reach girls who don't have access to school, and other programs where we provide teacher training and other. But critical to all of this is, yes, please, the next slide, is actually working to tackle what I've called the deadly assumptions now under this pandemic, and previously the myths and the hidden epidemics that so many technologists and content providers aren't necessarily experiencing every day. When we launched in 2014, to talk about texting over feature phones as a lifeline and a pathway to livelihood, it was as though the feature phone, as Sebastien said, low tech, didn't have the meaning it should, whereas we were arguing this is the tool of the majority. So rather than calling it low tech, we call it the tech for the majority. And how do we co-create with the majority in order to provide relevant, accessible, affordable solutions that matter? Ultimately, this notion that people have time is the greatest myth that we've seen to date in technology. That people can sit online for 1 hour is an incredible expense of time and money. So what if you could deliver an essential skills programming in minutes with the same value, if you will, of their time? What if most people don't have internet? And that's a fact. When we assume they do, we develop products and solutions that aren't matching the need. That people are reading at the level of information provided. When you scan the World Health Organization websites and other incredibly important resources, you'll find that they're at a readability level of college or above. Most people read below an elementary school level and ultimately need it contextualized and localized to matter. How will we begin to bridge this gap together to create more programming and offer that at scale? And the idea that remote learning isn't as meaningful as in-person or face-to-face. With the programs that we offer, one learner has access to a world of resources in the palm of their hand over texting. Let's build from there and continue to learn from each and every one of them. The idea that tech is the solution for all has always been often talked about here in the Silicon Valley. Is it merely a tool? Yes. Without a human touch and without the meaning behind it, it can actually become an unintended tool that has unintended consequences that are negative. So let's be open to where we see those negativities so we can act to bridge the gaps. The gender digital divide and others are examples. And on the keys to success with remote learning, what we've found since 2012, ultimately making available programming that's co-created and iterative 24/7 is key. When we talk about honoring time, we mean it. People are busy, multiple jobs, multiple, I would say, multiple pressures pulling on a daily life that isn't easy to navigate. Universal accessibility, you've heard already about universally accessible tech, from a feature phone to any device, being able to deliver programming across them and making them relevant and ultimately individualized to learner is the goal. And then ultimately universally accessible in terms of literacy level. If you're designing, and in our case, we started with level 0 of reading for a busy adult and built from there. We've learned so much from our learners. We assume we've learned more from them and have been designing in their essentially in response to their texts and their feedback, and will continue to do so. And then last, the relevant and meaningful piece on the content side. Co-creation we keep talking about, and we really mean that. Every text is feedback from an end user. Every partner provides their needs. Every local contextualized program we work with is a moment where we can connect. And again, to push back on this idea that low tech isn't as meaningful and the most meaningful, it is those critical connections that are creating programming that actually leads to scalable solutions. That's been a challenge in the field, that we can only do small pilots worldwide. With this co-creation and this vision at scale, we could truly reach millions together. And the last but not least, with that human touch, we can provide a connection to bilingual or multilingual coaches that you can call or text with. The idea that that is a heavy lift or burden is dispelled, because you can text or call and connect via the phone, via KaiOS phone or other, and we continue to see results. And I'll end with the notion that is critically important to innovation in this field: humility. Again, not knowing so much about the multiple competing challenges people face every day just to struggle under a pandemic, let alone daily life. It helps all of us as innovators, as teachers, as co-educators to learn more from our end users. So I'll pause there and look forward to questions.
Thanks, Jessica. So now we'll conclude the roundtable with Asim, and Asim is going to talk about health. Asim?
Thank you, Sebastien, for inviting me here. My name is Asim, and I'm actually the founder and CEO of WebDoc. I want to talk about how technology has changed the world, how companies like Blockbuster in the last few decades has just vanished, and Netflix has taken over. I will also quickly give you, you remember, if you all know, Kodak used to be one of the biggest camera companies. The phones have come along and they've actually taken out everything. The company just vanished from there. Recently, we have seen companies like Alibaba, Amazon, Uber became unicorns, and there was only one thing common in these companies, and that is they don't have much assets. They only have platforms, and they provide platforms from A to B and became unicorns in a very, very short time. COVID-19 is a pandemic and certainly has stuck the world really bad. Everyone is just stuck in homes and we are actually locked down. However, it has actually taught us lessons. They've actually given us that how can technology transform things. If you see e-commerce business, banking, insurance, even health has digitalized and transformed within weeks. People realize that there is an alternative way to connect through data or internet. The world has certainly changed, and it will change going forward 10 times faster. However, let me just tell you this thing, that especially in the developing countries, affordability remains an issue. The phones, we've got this very fancy phones, they're pretty expensive in markets like Pakistan, the developing countries, and the people cannot afford these phones. Pakistan is one of the fastest growing internet and smartphone market. However, still 35% of the people actually converted. 65% of the people in Pakistan still have no access to data, where this low-tech internet is very, very useful. We're talking about, only in Pakistan, we're talking about over 120-30 million people who does not have an access to the data. Once they don't have an access to the data, they don't have an access to the world, really. Imagine we have internet access for everyone in Pakistan. we would have saved more lives, we would have served more patients, we would have been able to provide more information, preventive measures to the people before this crisis. And obviously we were unable to provide this information to them because of this data unavailability. I'll quickly tell you about WebDoc. WebDoc is actually a platform which connects doctors with subscribers. So WebDoc was actually created in 2017, about 3 years ago, and we have a phenomenal growth. One main reason for the growth was that we actually were able to provide accessibility in a very low price. We only provide the service for as low as ₹1 a day for a full family to get services of the doctors. All these doctors are PMDC certified, and in about 3 years, we have reached excuse me, we have reached 6.5 million people in Pakistan. We have served more than 4.5 million calls. We have actually provided prescriptions to over 2 million people in Pakistan. So, even on that low price, the company has been very stable. Because of this low price, and these big numbers, the company is pretty stable. We are looking forward to provide different services, from WebDoc to WebDoc services. So we have actually gone into the lives of rural areas, people into the agriculture and stuff. We have provided them vet doctor services. We have provided services for their livestock. We are now providing services for their health insurance, life insurance, income protection insurance. We are on the road to provide them experts like legal and teachers over the phone. This is on our roadmap. We're hoping that by 2022, we will have over 15 million subscribers for WebDoc, and we will be able to provide doctors in the pocket to everyone in Pakistan. And with the help of services like KaiOS, we would be able to actually extend our arms to international communities where we can serve healthcare to all those people who can still buy cheaper phones and have affordable healthcare services. And Mike, any questions are welcome, guys.
Yeah, thanks, Asim. So I hope you enjoyed the presentation and have a better understanding of how policy, product innovation, and useful content can help to create this digital lifeline so much needed in period of crisis. I also hope that next time somebody tells you he works on low tech, actually you will look at him with a supportive eyes. And that brings us to the end of the presentation, and we will now move to the Q&A session. Tim?
Hi everyone. So if you have questions, you can bring them into the Q&A panel, and then we will review them and give them to the right panelists. So we have one question from a developer, Sebastien, that is asking how can they currently monetize their content, and what do we plan to do in the future to add additional opportunities for them to make money from their content?
Yeah, so we offer different ways for the developer to monetize. They can deploy applications which are free and with some advertising, for example. So we are growing this type of revenue for the developer, because as the developer indicate here, it's really important to create a healthy ecosystem that developers find an interest to work on the platform. So more content is available. But beside the free application with advertising, we'll also make available some payment capabilities that will allow developer to sell service and application. So this is coming very soon.
Okay, thank you. Are there other questions from other attendees?
Tim, do you mind if I jump in, if that's okay? Since we
Sure,
are panelists,
sure.
we can also ask questions and have a discussion.
Yes.
I really enjoyed listening from all of you, and from Jessica, Sebastien, and Asim. And one of the areas I didn't want to go too much into it, because I knew we were going to hear from Jessica, was around how, specifically in the context of this crisis, the importance of different kinds of information sharing tools and applications, and on low-cost devices, right? Different kinds of low-cost devices, especially for educational purposes. You know, all of a sudden, people around the world and students around the world have, you know, been sent home to either be on their own or try to maintain some kind of learning system going. And I would love to hear from Jessica about you know, some of the differences in how different countries have been able to navigate this crisis in transferring a lot of the educational tools and processes and ways of keeping students on top of their educational needs, but using the internet, using digital tools, etc., and understanding the different kinds of techniques that are used in different parts of the world, and especially out for rural communities and those communities that tend to have the highest you know, challenge in terms of having either affording devices, affording data, and the kinds of services that are necessary to be able to go online for educational purposes. And I would say the same is true as a question for health, but if you don't mind, Jessica first, that would be great. Thank you.
Thank you, Sonia. What an important question. We found that right away in March, when people realized they would be sheltering at home, CELET has the great fortune of operating in over 14 countries, an immediate influx, because what we happen to be known for is a call-in option with no internet over cellular. So ultimately you can get a pathway to a certificate or programming, even if you're calling in on your cellular line or if you're going on a KaiOS phone or others. But ultimately it's that call-in that ends up being the ultimate lifeline. The two challenge areas were accurate information about COVID-19. Information coming from the World Health Organization is accessible via a chatbot that is at a literacy level above most users. And if they're accessing a chatbot, it often means they're navigating internet and they have email addresses, which the majority of our users do not. So right away, if you make available essential skills, programming, reading, math, communication skills, work skills over micro lesson content, and make that available for free, suddenly you're going to see more direct to learner, which is what we've ended up doing. So we've committed to reaching and providing 1 million vulnerable learners with free programming, access to any of our literacy, language, and other programs. We think that's essential as a social enterprise to meet the scale of need. The other piece of the puzzle is a lot of people don't realize that on smartphones, people are calling in. In the United States alone, we have 48% of our users calling in. Doesn't mean they're on a feature phone. It means that there's something about accessibility in terms of not only interface, buttons, usability, and price. There's so much nuance in UX UI design that it's important for us as mobile learning providers to be very vigilant about ultimately radically accessible interfaces and usage in multiple languages. So we have to push the envelope there. Last, there's been requests to provide partner content at scale to remote and rural populations that currently have no lifelines. And that's also an imperative. If we are a customizable messaging platform, what is that content? How can we get that converted, co-created together and available at scale? That's currently what's keeping us up at night.
Thanks, Jessica. We have a question from the this person to the front now. Yes.
We can hear you, team. Go ahead.
I'm unmuting the.
Hello.
Yeah,
this is
Hello,
Kwaku from Ghana, FRI coordinator. Thank you to all the panel members for the brilliant delivery. I had actually penciled my question with the hope that there would have been an ITU link also on the panel. But my question relates to the efforts being made, as mentioned by Sonia, by the ITU to ensure that all countries can bring up the development of their statistics related to the urban rural usage of internet by gender segregation or aggregation. Unfortunately, if you go to the ITU statistics on gender usage, some countries, including Ghana, are not there. Unfortunately for these countries, there are many NGOs, FRI inclusive, in those locations who are trying to help to develop these statistical basis for inputs for global planning. Now is the time that we've seen that we need a global action to plan and not even a sectorial action. My question is, it should be brought to the attention of ITU to encourage these emerging administrations to partner with the NGOs who are in their localities so that all countries can have their database on gender aggregation of internet usage, the ITU website. My other question goes to Jessica. Why are people not connected? One other big area is digital illiteracy. And I think that is an area that we need to pay attention to if we want to ensure that we can have internet usage right from the underserved areas. At the moment, I think we are concentrating a lot on the urban areas, a lot on academia, forgetting about the rural underserved, women who need education to use the new smartphones, which are simply made as also indicated in the low-tech technology, so that we can get the mass of the people using the internet. I want to thank the panel and indicate that this is a very important subject that will be introduced, and we need as countries. And for Ghana, we are committed to supporting the administration of Ghana to develop all the bases for internet affordability. Indeed, we are helping Ghana to come out with regulations on internet accessibility and open access by the private sector to their usage of their infrastructure so that internet can be affordable in the rural areas. Thank you very much.
Thank you. So I think the first part of the question is for Sonia. And then after that, Jessica can answer the second question.
Well, there's so much to say, right? Kwaku covered so many things. I'll just say a few. I mean, obviously, you know what we work on, and our focus with the Alliance is really on policy reform that brings about lower cost broadband access. And there's many different ways, as I mentioned earlier in my intervention, that can be done. What I would say is that in the context of this crisis, it's really important that any kind of intervention understands the links between, the access piece and the usability piece. We can't divorce either of them from each other. It's really important, and this is why, for example, we at A4AI, not just now, but we've been working on this concept that many of you understand about meaningful connectivity and how do you bring it all together. And that concept has a set of elements that are part of this new standard that we are going to be working on and promoting in the next couple of months, which looks at a combination of speed. Basically, it's a technical standard that brings the quality of experience to the forefront together with affordability, right? But it looks beyond just affordability to look at speed, data, the device that the user has to be able to really use and take advantage of the data, the opportunity that comes from it, and of course the frequency of use. Elements that without them, access is really not meaningful and not sufficient to support the kinds of services that Asim was mentioning, that Jessica was mentioning, and many of us are concerned on a daily basis. And so working with policymakers to make sure that all of those pieces come together is absolutely critical. But I'll stop there. There's a lot more, and we don't have a whole lot of time, so that Jessica and Asim can also jump in, and Sebastien. Thank you.
Great. Thank you, Doctor, for that helpful statement around the divides, especially around digital literacy and the importance in that programming. This is my 24th year working in mobile learning and the digital divide, and it doesn't get easier, and it's incredibly nuanced. And a key piece of the puzzle, starting with non-literate women in their first language, and providing pathways to learning that she directs over a feature phone, was key to learning what integrated skills or essential skills needed to be delivered a two-way to her. And part of that integrated skill or essential skill building approach we adopted includes right away some of those things. The critical literacy skills must be combined with the digital literacy skills, how to utilize that handset, and ultimately with that two-way interaction, getting her to drive her learning and her own pathways to livelihood. So I think that's critical to have integrated skills around digital literacy. We did start with remote and rural. There's lots of factors that make it on the ground solution centered. What works in one community doesn't work in another. So there's a piece of the puzzle here. As radically accessible as these technologies are, the importance of this local understanding between districts in regions and provinces and communities is also important to consider.
Thanks, Jessica. And Gitanjali, you also want to add something to the question?
Thank you, Tim. Thank you, Dr. Kawaku, for bringing this important topic. You know that for ITU, gender equality and mainstreaming is extremely important. And we do look at gender disaggregated data, and our statistics team and also our development bureau focuses on this actively. We will definitely get in touch with you to provide you with more information. So I will put our email address on the chat pod, and please do coordinate with us after the chat. Thank you very much.
Thank you. We have two more questions about KaiOS, so I'll bring those live, and then Sebastien can answer those. The first one is from Karim. Can you see the question, Sebastien?
Yeah, I just saw it. So the question is how many users actually of KaiOS are present in Africa and Middle East? And so I'll start with that. We actually started deploying KaiOS with different operators and manufacturers in Africa and Middle East in the second half of last year. So it's something quite recent, and we have today probably around between 1.5 and 2 million users in Africa. But it's a market we just started. The company started 4 years ago almost, and Africa has just started in the second half of last year. And the second part of the question was, do you think your product and services are affordable by the least developing country citizens? And so as I explained before, I think the effort, and we recognize there's still a gap between a 2G voice device and N3 KaiOS device, which is probably around, let's say something like $10 gap. And what I explained in the presentation before is we are deploying a device financing program to make sure that we close this gap and make internet capable device available at the same price as a voice device in the near future. So we are working on closing this gap, and we'll make sure that the device become completely affordable in the coming months. Yes.
All right, thanks. Then there is a second question. I made it live now, so you can see it. And then in the meantime, for everybody else, if you would like to ask a question, there's no chat function, but you can use the Q&A function and put additional questions in there. Can you see this question, Sebastien?
Okay, so maybe I'll start to answer, and if you want, if some other panelists want to add some comment. So we are. So the question is about the protection, basically protection of the consumers, especially the child, on the content and the application made available. So we are actively testing and checking the content which is made available on KaiOS through the store, and we have a let's say quality and a verification of the content which is made available on this on the store. So this is one side on the test of the content, and the second side is on the protection of the users. So we decided as a company when we started to deploy in different countries, in more countries 2 years ago, to follow the GDPR regulation on data privacy and protection. And we follow GDPR actually worldwide, including in countries where there are no regulation related to protection of data and privacy. So I hope it answers your question. Maybe Sonia, if you want to add something on that.
Sure. I mean, I actually would love to also hear from Asim and Jessica, because they are on the front line supporting children and their families with, health services, education, the kinds of things that we also need to consider, not just protection, but frankly, privacy and safety online. From our perspective, as you know, both at A4AI and the work of the Web Foundation, that I urge you all to take a look at, especially the policy briefs that we just put out in the last couple of weeks, and the work that we are doing, focusing on that precisely, that we have to consider all of these issues as we develop technology and services, and policymakers have to be very serious about how they address these questions. I appreciate the question from Mr. Maniaya from Zimbabwe. It's a responsibility that you have, of course, to make sure that all consumers, all users, children and elders are protected and their data is protected. What I would say is that the lack of either an immediate data protection bill or law, or an immediate policy instrument to address these, should not be a barrier to access. I think these things can happen at the same time, and what happens often is that policymakers get a little bit anxious about, should we allow for new services to go out to the market if we don't already have something in place? Yes, it's an important question to ask, but I think that if working in partnership, especially with the private sector, and I think KaiOS is a good example of what Sebastien just mentioned, and many other companies I think are focusing on that. Working in partnership, you can definitely make the services and affordable access available for people, while strengthening the regulations that are going to protect not just personal data, but also securing privacy and security. But what I would say and highlight, which I think it's really important, especially every time, but especially now in times of crisis, is that should not be a barrier to access, which that would be to the detriment of what we're trying to do here. I also just want to put a very quick plug on a study that we're doing. It's not published yet. It's coming out in a couple of weeks, on a research study that A4AI is doing on devices and the cost of devices, and how device affordability affects the ability of users to not only use different kinds of services, but also be able to be connected. And it's been really eye-opening to look at some of the early results that are coming from that study, not just because of device affordability issues that you all know it's a problem, but about usability, how that also reflects the decisions that users take on what kinds of devices they want to experience being online with, and what kind of services then they'll be able to have. And I think that, I hope that you can all take a look at that soon, but it's really, making us think differently about also that interaction of, how people use connectivity and benefit from connectivity through the kind of device that they may have access to. But I'll pass it on to Jessica and Asim again. Thank you.
This issue of safety online is of critical importance. And as Sonia mentioned, on the partnership side, reason why we've partnered with another innovator in this space, particularly WSIS, a Dutch-based company that has a searchable internet that is safe and at the readability level of its users, including children. And with that ability to search and actually have a content curated at the level of your learner, of that child and others, all the questionable materials have been removed, is an extraordinary resource. And we ultimately add that additional reading and other materials to our users, our learners who are on our system. So I encourage you to look up WSIS and see what they're doing in terms of a searchable, safe internet.
All right. Yeah. I mean, for the health services, there is a lack of policies in Pakistan, especially how the internet must be used from the government. That is one issue. Then coming back to the health services, what we have done is within our company, we have actually created a few policies that we can, health is a very sensitive issue. So we have policies that if you are 14 years and under, you cannot be actually checked by the doctor unless there is a guardian or another person, adult, is with you. But if you're over 14 years, then we actually provide you services. And then these are limited services up to 16 years that we do talk about your health. We do talk about other issues. However, we stop not talking about their personal issues. However, if there is a parent, if there is a guardian with them, then we actually go in details. In Pakistan, there are other issues also. Because of the regional and cultural issues, women in Pakistan, they cannot go to a doctor for their physical issues. Even men cannot go to the physical issues. So with the phones, with the services like WebDoc, people can actually hide their identity and still talk about their health, which is whether it's physical health, whether it's sexual health, whether it's any other part they normally tend not to speak to doctors. They can actually speak over the phone or the internet. However, we have our in-house policies where we actually make sure that internet actually is used properly and in a good manner for the health services. There is a lot on the government side to do with the internet and their policies and privacy policies, which is yet not in place, and we hope this will be placed in soon.
Thank you, Asim. Sebastien, we have a question about the Mozilla partnership with KaiOS. Can you say something about that?
Yes. So the question is how and what will be the benefit of this partnership. I think something we announced a couple of weeks ago, or maybe 2 months ago. The benefit of having this partnership in place is that we'll be able to have a more maintained and more evolution on the framework, let's say the software framework we are using in KaiOS, which is originally an open source development from Mozilla. And we'll have some evolution, and we'll have some testing and joint testing done with Mozilla as well. So benefit for the developer is you will have access to more, let's say, evolution of the framework and more modern version of the framework. Tim?
Thanks. Okay. About educational usage by other countries on KaiOS phones, I don't think we have many other examples of that. Maybe Jessica, do you have more examples about how technology is used in the classroom, or do you want to add something, Sebastien, on that question?
Well, we have a couple of partnerships. Actually, we are launching, and we announced recently in Nigeria. We announced in some other countries as well. So we have partnership with education content providers and some content available also through KaiOS Live app. Yeah, I mean, if you are interested, you can connect to us on the website, and we'll give you more details.
Okay. And Jessica, is there anything? How do you work together with countries and governments?
this is that collaboration I mentioned. It's traditionally, if it's a ministry of education or work readiness or gender and equity arm or health arm of a public sector player and country, it's usually because they need programming to be made accessible and at multiple readability levels and languages. So we start there with the need and for the population served. And ultimately, it's what programming gets converted into this micro lesson two-way texting format. Once we test that with our actual end users, whether they're formal or non-formal education solution users, then we make it available at scale in country or across region. And so that's content that spans a formal education, literacy, numeracy, teacher training programs. That's content that includes mobile health and access solutions. It's COVID-19 programming are examples. But ultimately, some of the others that are global are one of the unintended consequences of COVID-19 is gender-based violence programming, and making that available at scale and for free is another piece of the puzzle. So that's across countries as an example. But working together, figuring out what the need is, and working both with non-governmental organizations, education providers in country, public sector, and then at some points, some of private sector businesses who need to employ workers will also work with to make sure there's a bridge to jobs as well.
Okay, thanks, Jessica. We have another question also for you. Can you read it?
I do see that. That's our newest programming. We released COVID-19 programming, a 4-part certification program in multiple languages, just so that people had access to accurate information about COVID-19. What are some of the symptoms there? What are some of the myths that we could dispel so that we all stay safe? And the last piece is a little bit on the health and wellness piece. It's stressful for all of us enduring this collective trauma together globally. The CellMed arm is actually a HIPAA compliant backend server and additional tools used by health practitioners that we tested last year and aimed to release in June, and have launched those earlier due to the COVID-19 crisis, including a certifying arm for health work, but also some other pieces around remote health and telehealth. So ultimately, when folks used to be able to go into a community clinic or a hospital, et cetera, now, of course, that's not possible. How can they continue some of their both chronic disease prevention and health work, and also in terms of infectious disease understanding and programming? So there's a lot more to come there, but I'm happy to share if you reach out.
All right, thanks a lot. I think we get to the end of the time here, so I give it back to you, Geetanjali. But if anybody else has any more questions that we haven't been able to address, then feel free to reach out to us for KaiOS on the website, or other people on Twitter or to their websites. Thank you very much.
Thank you very much, Tim, and to all the speakers today for such an exciting and interesting talk. It's really very close to reality, and it also brings our attention to the needs of this hour. Education right now, of course, is extremely important with so many of our kids doing online education. So thank you very much, Sebastien, and to all the speakers, Sonia, Asim, and Jessica. This is to also remind all the participants that our next WSIS talks will be on the 12th of May. It's on tech and trafficking in persons during COVID-19. So please join us on the 12th of May for another round of an interesting virtual WSIS talks. Thank you very much. Thank you.
Thank you.
Thank you all. Bye-bye.
Thank you so much.